वैद्यकेन योपाकरोत्तं प्रवरं मुनीनां पतञ्जलिं प्राञ्जलिरानतोऽस्मि.
Namaste. Welcome you all for the yoga session. In this session, we are going to do some postures for the health of the shoulders. We shall begin with some preliminary postures. Lie on your back, fold both legs, heel closer to the hips, foot 6 inches apart but inner edges parallel. Keep both the palm on the abdominal cavity. As we inhale, the abdominal cavity should expand, and as we exhale, it should contract. Chin towards the chest. Feel the complete back muscles. The paraspinal muscles, especially the lower back, they also respond to the breathing. Stretch both arms up. Raise your right leg up. Pull the kneecap, stretch the heel. Toes towards the knee, kneecap towards the hips. Keep the legs straight, but ensure that the base of the spine does not take off the floor. Watch your breathing. Fold right leg down. Chain. Left leg up. Stretch the heel. Pull the kneecap. This is a simple stretch for the hamstring muscles, that is the back of the thigh and also the calf muscles. It also benefits the hip and the lower back. Breathe consciously. Left leg down. One more time. Right leg up. Feel the stretch in the back of the thigh and also the leg. This also benefits the complete lower extremities, hip, knee, ankle. These preliminary postures make other movements safe and easy. Right leg down, chain, left leg up. It is very important to stretch the heel, that is toes towards the knee. So that will engage the Achilles tendon, which will enhance the stretch of the calf muscle, and that in turn enhances the stretch on the back of the thigh, that is the hamstring muscles. Feel the stretch. Feel your back. Feel your abdomen. Left leg down. Right leg up. Fold. Hold the knee. Press the knee closer to the chest. Do not move the knee away from its plane. This is a simple stretch for the gluteal minimus and medius muscles, hip muscles. Even here you got to stretch the heel, that is toes towards the knee. Breathe well. Release right leg. Chain left leg. Left leg up. Hold the knee. Press the knee closer to the chest. Tighten the back of the thigh, that the hamstring muscle group on both the legs. So that will help to engage the knee capsule better. Feel the hip and the back. Release left leg. One more time. Right leg up. Hold the knee. Press the knee towards the chest. Stretch the heel, right heel. Tighten the back of the thigh. Even on the left leg, press the left foot. For that you have to activate the calf muscle, tighten the hamstring so that the inner corners of the knee are well engaged. Breathe well. This also helps the abdominal organs as we inhale and exhale. Release right leg, then chain, left leg. Hold the knee, press the knee towards the chest. Because of the pressure of the thigh against the abdomen, when you breathe well, the abdominal organs get a good massaging effect in this posture. Release left leg, right leg up, fold from left hand, hold the ankle joint, pull it across the left thigh, from right hand push the knee. Even in this posture, you have to tighten the inner corners of both the knee. For that you have to engage the back of the thigh, hamstring muscles. And breathe well. As we inhale, feel the base of the spine. Release right leg, chain, left leg. Left leg up, fold from right hand, hold the ankle joint, pull it across the right thigh. From left hand, push the left knee. Tighten the corners of both the knee. This is very important. This posture also helps the knee and especially the sacroiliac joint, that is the joint where the spinal column and the hip bone meet. That is where they articulate. Release left leg. One more time, right leg up. Fold from left hand, hold the right ankle joint, pull it across the left thigh, From right hand, push the knee. Use your breath to feel the base of the spine. Release right leg, chain, left leg. Hold from right hand, hold the ankle joint, pull it across the right thigh. From left hand, push the knee. You can take the foot as close to the root of the right thigh as possible, but it depends on the stiffness of the knee. These preliminary postures are very useful for all other practices. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it from right hand, push the knee across the chest. So you have to pull very strongly and also press the knee very strongly across the chest. This is an excellent stretch for the gluteal maximus muscle, which is one of the major muscles of our body. Then watch your breathing. Slow inhalation, slow exhalation. Gluteus maximus muscle is another very useful muscle for the back. Release right leg, chain. Left leg up. From right hand, hold the ankle joint, pull it. From left hand, push the knee across the chest, but ensure that the pelvic rim does not rotate out of the ground. Breathe well. You are stretching one of the major muscles in the hip. Release left leg. One more time. Right leg up. Fold from left hand. Hold the ankle joint. Pull from right hand. Push the right knee across the chest. Even here, engage the hamstring muscles so that the knee capsule gets a rejuvenating movement. This should be done on both the knees. And in all these postures, you have to breathe slow and steady. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. You have to use the force from your arms to have that penetrating stretch into the gluteal maximus muscle. Tighten the hamstring muscles on both the legs. Do not hold the breath. Breathe well. Release left leg. Stretch left leg forward. Slowly get up from the right side. Sit upright. Sit on a folded blanket, hips on the blanket, foot on the floor, chest and navel up. Look forward. Clasp the fingers. Inhale, exhale. Stretch both arms up. Open the palms up so that you get a good stretch for the fingers, wrist, elbows. Complete shoulder complex gets a good stretch. Feel the breathing. The scapula, the shoulder blades also gets activated here. The armpit, the upper chest, they all get a good stretch in this. Breathe consciously. Slowly bring both arms down. Shoulder joint is one of the very complex joints. Now sit upright on the floor with crossed leg, then take palms with middle finger pointing forward, press them on the floor, slightly behind the hips, arms straight, open the chest, lift the sternum or the center of the chest up, neck slightly looking forward so that you get a good stretch for the region of the neck also. This is a simple shoulder extension movement. It is good for all the muscles in the upper cavity, the pectoral muscles, they all get a good stretch. The intercostal muscles also experience a good movement in this. Breathe well. Feel the palm, the pressure on the palm, the fingers, the wrist, forearms, elbow, upper arm. Slowly check out the palms, sit upright in swastikasana. Shoulder joint is a very flexible joint. Now take both hands back, clasp the fingers. Now you have to rotate externally. That is, take the thumb down first and then rotate, pressing the palm slightly behind the back. And we'll open the chest. Thrust the chest up and forward. Look forward. This has a better effect, especially on the upper chest, the region of the collarbone and below that. They all get a good stretch, good opening. Any congestions there can create a lot of problems, especially in the modern living style of usage of computers in excess. So that thoracic outlet there gets a good relief. Press the palm well up on the shoulders. Feel the junction between the upper chest and the shoulder. Feel that spacings. Watch your breathing. Now slowly release the arms, take them forward, sit upright and cross-legged. One more time. Press the palm behind the hips, middle finger pointing forward, arms straight, well open the chest. Now slightly move the hips forward so that the angle between the arms and the trunk increase. In other words, the extension movement of the shoulder joint is further enhanced. But middle finger should point forward, you should press the palm, you should press the base of the wrist, elbow straight. Feel all the fingers, the contact between the fingers and the floor, palm and the floor. When you take the hips little away from the palm, you can see the stretch increases. Look forward. These postures also help the muscles around the neck. So anything that we do for the shoulder complex essentially involves the neck muscles also. Now slowly take the hips back, release both arms, sit upright. Movements for the shoulder joints have to be done in a graded way, because although shoulder has a good range of movements, in terms of stability it is quite weak. One more time, clasp the fingers at the back, open out, that is taking the thumb to the ground and then turning it back. In other words, externally rotate the shoulder joint. Pressing the palm, move the hips little forward so that the stretch is further enhanced. Now the shoulder joints are much closer because the palms are locked. That way the center of the chest gets a better opening. Watch your shoulder joints, watch the chest, watch the junction between the chest and the shoulder complex. They all get a good movement. Also good for the arms, wrist, palms. Move the hips back, release the arms and relax. Watch your shoulder complex. Be aware of the movements, complex movements that are involved. Now press the palm, take the legs little forward, flex the knee, knees slightly bent, press the palm slightly behind the hips, foot 6 inches apart, but inner edges parallel, chest and navel up, middle finger pointing forward, press the palm, inhale, exhale, rise the hips up. Then relax the neck muscles. This is called Chatushpada Pitasana, or the table posture. Very good for the shoulder joints. It gives the so-called the movement of shoulder extension. Chest up. Center of the chest should be elevated. Press the foot. Breathe well. Breathe consciously. Watch the chest, the collarbone, both ends of the collarbone. There are two intricate joints, the acromioclavicular joint and sternoclavicular joint. They also have to work. Slowly, as you exhale, come down, sit upright in swastikasana. Shoulder joints should have strength, flexibility and stability. One more time. Press the palm slightly behind the hips, middle finger pointing forward, foot slightly forward, 6 inches apart. Inhale, exhale, rise the hips up. Arms nearly perpendicular to the floor, trunk and thigh nearly parallel to the floor, neck relaxed, legs nearly perpendicular to the floor. So that is Chatushpada Pitasana. Relax the neck, relax your tongue, breathe well. This posture imparts both strength and flexibility to the shoulder joint. It also helps the upper chest, the pectoral muscles, the intercostal muscles. They also get a good movement. Slowly descend, sit upright in swastikasana. Now we are going to do one good stretch for the deltoid muscles as a relaxation. Stretch your right hand. From left hand, lock the right forearm, pull it closer to the chest. Keep the right hand straight. This is an excellent stretch for the deltoid muscles. You have to take it as close to the chest as possible. Use the power of the left hand to pull the right hand closer to the chest, keeping the right hand straight. Relax, chain, stretch left hand. From right hand, pull the left hand closer to the chest. This also helps your scapular region. The pull has to be strong. Relax. The shoulder complex is a complete system. The movements not only comes from shoulder joint, then the acromioclavicular joint, sternoclavicular joint, and also the gliding of the shoulder blades that are involved. Now take both arms at the back, clasp the fingers, rotate externally, press the palm, stretch the legs little forward, flexing the knee, press the foot, inhale, exhale, rise up. Rise the hips. Relax the neck. Well open the chest. Holding this way further intensifies the stretch at the shoulder joint, the upper arms, and also the chest. Wrist and elbows also stand to benefit. You have to press the foot. Relax your tongue, relax your breathing. Slowly descend. Relax the arms, fold the legs, sit upright. Persons who have a history of dislocation of the shoulder joints should do it only under the supervision of a trained person. One more time, clasp the fingers, open it out, press the palm, open such a way that the shoulder joints rotate externally. Take both legs little forward, foot 6 inches apart, press the foot, press the palm, inhale, exhale, rise. Be firm on the foot. Rise the hips. Thigh, hip, trunk should be in a plane parallel to the ground. Arms perpendicular, legs perpendicular. Breathe well, hold these postures for at least 20 to 30 seconds. All these postures also help the neck. Especially these movements of shoulder extension greatly benefit the upper chest. Slowly descend, sit in Swastikasana. One more stretch for the deltoids. Right hand on the left knee. From left hand, hold the wrist and pull and slightly lean forward. These are some intermediate postures to relax the upper arm and the deltoid regions. Slowly come up, chain. From right hand, hold the left wrist, rest the left forearm on right knee, pull and then slightly bend forward. So slowly come up. Sit upright. Always learn to watch your breathing. Get connected. Stretch both legs forward. Press both the palm by the side of the hips, middle finger pointing forward. Chest up, navel up, foot 6 inches apart. Palm by the side of the hips. Well open the chest. Foot parallel, 6 inches apart. You have to use the heel as the reference to swivel into the table posture or Chatushpada Pitasana. Inhale, exhale, rise the hips up, press the foot, well open the chest, relax the neck. Press the palm, spread the fingers, watch your wrist, elbow, shoulder joint, upper chest. As we exhale, slowly come back so that the hips will come to from where it took off. One more time, inhale, exhale, rise. Breathe well, open the chest. As we exhale, slowly come down. Inhale, exhale, rise. The position of the heel, position of the hip, we should be mindful. They should not change. Slowly come down. So keep that reference proper so that the movements look graceful. Inhale, exhale, rise. So these movements help the shoulder joints, elbows, wrist, the complete musculature of the arms, good for the neck, good for the upper chest. Also helps in strengthening the back down. One more time, inhale, exhale, rise. You have to press the foot firmly and lift the hips up. Shoulders normally get rounded in today's work culture. This prevents that. Come down. Sit upright in Swastikasana. Health of the shoulders is very important because it has implications on several things like problems with the neck, the other problems like thoracic outlet syndrome, where the brachial nerves get into compression. So these movements can effectively mitigate and prevent such problems. Watch your breathing. Take the blanket, sit in the all fours or Chatushpadasana knee on the blankets, knee below the hips, palm below the shoulders, middle finger pointing forwards, trunk nearly parallel to the ground. Fold the toes inward, inhale, exhale, legs straight. Trunk nearly parallel to the ground, foot nearly perpendicular from the base of the metatarsals to the heel, foot perpendicular. As we inhale, abdominal cavity should expand, as we exhale, it should contract. Watch the weight on the base of the palm, spread all the fingers. Feel that contact surface. Flex the knee, come down. Watch your breathing. Watch the shoulder complex. One more time. Fold the toes. Inhale, exhale, legs straight. Trunk nearly parallel. This helps to strengthen the wrist, elbow, and the shoulder complex. It is very important to maintain the range of movement of the shoulder joint. Otherwise, it is very easy to lose them. If you do not use, you will lose. Flex the knee, come down. Sit on your heel. Sit upright. Sit in the all fours. Again, middle finger pointing forward. Fold the toes in, inhale, exhale. Move to Adho Mukha Svanasana or downward dog pose. Hips towards the ceiling, head towards the flooring. Arms straight, legs straight. Pump the scapular region up, but stretch the spine down. Keep both the palm firm. Middle finger pointing forward. Press the palm. Be strong on both the arms. Press the foot. Keep the legs straight. This also is an excellent stretch for both the upper extremities and the lower extremities, especially the shoulder joints gets good strength in this posture. Flex the knee, come down. This Adho Mukha Svanasana is an excellent all body stretch. You have to press the palm should not slide forward. That grip is very, very important. One more time, fold the toes, inhale, exhale, hips up, head down. Pump the scapular region up, but stretch the spine down. Breathe well, Feel the abdominal region, feel the chest, watch the region of the armpit, neck relaxed, hit the back of the knee, press the heel. This posture also helps the stability of the shoulder joint. Flex the knee, come to the all fours, sit on your heels, sit upright. Most of these yogic postures provide not only flexibility but also strength to the shoulder joints. Sit sideways. Press the wrist or the palm on the floor, middle finger pointing to your right, left hand on the waistline, wrist, hip and ankle should be the same line, knee slightly bent. Now inhale, exhale, rise up, straightening the knee, pressing the foot. Then stretch your left hand up, look up at your left palm. Push the knee forward so that arms, trunk and legs are all in the same plane, perpendicular to the ground. You have to press the right foot. Left foot is above the right. Lift the hips up. Slowly descend. Change side. Press the left palm on the floor. Finger pointing to your left side. Flex the legs, wrist, hip, ankle in the same line. Right hand on the waistline. Inhale, exhale, rise up. Press the left foot properly. Right foot on the left foot. Lift the hips up, stretch right hand up and look up. And engage the arms properly. That is, you have to activate the muscles in the upper arm and forearm. Feel the contact pressure between the left palm and the floor. Bring the right hand down, then slowly descend. Sit upright. So this posture helps the sideward movement of the shoulder joint. One more time. Press the right palm on the floor, wrist, hips and ankle in the same line, knee slightly flexed to begin with, left hand on the waistline, inhale, exhale, rise. Stretch your left hand, look up. Activate the complete arm musculature. The arms have to be aligned properly. This helps to Improve the sideward movement of the shoulder joints, slowly come down. Also helps to strengthen and stabilize the shoulder joint. Change side, press left hand on the floor, right hand on the waistline, knees bent, wrist, hip, ankle in the same line. Inhale, exhale, rise up. Do not push the hips back. You should maintain the plane. Inhale, exhale, rise, then stretch your right hand up. Turn the neck and look up at your right palm. Breathe consciously. Feel the shoulder complex. Right hand down, then slowly descend. Sit upright in Swastikasana. Watch your breathing, watch the region of the shoulder complex. To sit on the blanket, hips on the blanket, legs down. Keep the trunk upright, chest up, shoulders relaxed. Both the palms should face upwards. Tip of the thumb and index finger in contact. Relax your tongue, nose, throat and the jaws. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Learn to exhale a little longer than you inhale. Now we are going to do the Brahmari Pranayama, a very good relaxing breathing technique. You take deep, slow inhalation, and as you exhale, pronounce the word hum internally without moving the lips or the tongue, and listen to the vibrations of the word hum in the region of the brain. Take a deep, slow inhalation. Be relaxed. Watch yourself internally. Feel the deep sense of relaxation. Complete shoulder complex and the arms, they are also relaxed. Feel that inner calmness and quietness. Just watch the breathing. Be a witness to the incoming air and the outgoing air. You don't have to manipulate the breath. You just have to be a witness to the breathing. The mind should get completely be focused on the breathing. Namaste.
योगेन चित्तस्य पदेन वाचा मलं शरीरस्य च वैद्यकेन